This conference will now be
Nobody is there,
recorded.
and I would like to perform.
Hello.
I would like to perform, ma'am.
I will.
Okay. Yeah, okay, fine. So today we will start general gynecology. I choose the 3 cases. This case, which I choose every day, they came in the last exams, whether in May or in November. And later on with each module, we will try to choose the most recent one and the most new one. Okay, so I have two names they asked me to start, so hopefully they are here. Sunanda, are you here? Okay. Vishnu, are you here? Okay.
Yes, sir.
So,
I'm here.
oh, is it Vishnu here?
Yeah.
Vishnu, are you here?
Yes.
Okay, so we have 2 minutes to start. The first cases. 2 minutes to start. Okay, you finish the 2 minutes. Start.
Yeah. Hello, I'm Dr. Vishnupriya, one of the doctors in the clinic today. Can I confirm your name and age, please?
Yeah, I'm Mary Stephen, 28 years old.
How may I address you?
Mary.
How may I address Mary? Mary, I'm given to understand from the GP letter that you have some concerns during intercourse and you are here to discuss about that. Am I right, Mary?
Yeah.
Yeah. Mary, before addressing your concerns, can I ask you a couple of questions to know more about you? Later on, I may need to examine you and run few tests, and later we can come to a suitable plan for you. Is that okay, Mary?
Yes.
Yeah. You may find few of my questions intrusive. Don't mind, Mary. Is it okay? Can I go ahead and continue consultation?
Yeah.
Yeah. Can you tell me more about your concern, Mary? What happened?
Yeah, I started my relationship 12 months ago. But whenever we have sexual act, I feel there is severe pain and I can't continue. really this condition
Mhm.
affect my relationship with my partner, and I'm afraid from any problem that happen later on. And I want to have a baby, and I don't know if this complication or these problem can affect this situation.
Hmm. Yeah, I'm so sorry, Mary, to hear this, that you're going through such a difficult situation. Definitely, we are all here to, as a team, to address your concerns. Is that okay?
Yeah.
Yeah. Yeah. You said you have difficulty during and pain during intercourse. Is it at the beginning of the act or at the deep penetration?
Yes. At the beginning, when the sexual act start, and when he try,
Hmm.
yes, that affect me, and there is severe pain, and he always
Hmm.
complain that he can't continue, and he can't continue the sexual act because of this pain.
Hmm.
I don't know
Hmm.
how, but he told me that he think that there is something blocked or something. He can't continue the sexual act. This is
Hmm.
this is what he told me.
Hmm. I'm so sorry, Mary, to hear this. Yeah. Otherwise, any discharge from down below?
No.
Any problem with waterworks?
Any problem with?
Any waterworks, Mary? Any problem
No,
with
no,
waterworks?
no, 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 no,
Problem with opening up of bowels?
no.
Mm-hmm. You are with this partner since how long with you are with this partner, Mary?
We married 12 months ago, but before that, I don't have any relationship. Even
Okay.
he can introduce at the beginning, but and
Mm-hmm.
he can tear my hymen. However, but he can't
Mm-hmm.
emerge more and more. And when he try to do this, I feel the severe pain.
Mm-hmm. Did you try any medications or any ointments,
No.
lubricants? You
Yeah, we
tried
try
for this?
lubricant. We try lubricant, but it doesn't work.
Mm-hmm. Mm-hmm. Okay. Otherwise, how about your periods, Mary?
It's regular.
When was your last period?
It was 10 days ago.
Mm-hmm. How about your smears?
In reality, I didn't do
Smear?
anyone. I didn't do anyone right now. Last time
Yeah.
the nurse tried to do her best, but also we can't. Um, she can't, and I'm scared from her. In reality, I don't like to go
Mm.
to any doctor regarding
Yeah.
this. Yeah, it's painful.
Mm-hmm. I can see that, Mary. Yeah. Otherwise, any medical condition that you are seeing GP for?
Wait, Dr. Simon, did you hear me? Dr. Regina, is there any voice?
Yes, ma'am,
Yeah,
I
I
Did
can
can
you?
hear
hear
you now.
you.
I
Okay,
can hear
fine.
you now.
We can.
Yes, that's it. Continue, doctor. Sorry.
Yeah. Yeah. Any medical condition, Mary, that you are seeing GP for?
No, everything is fine. I'm fit and
Any,
healthy.
any long-term medication you are on?
No,
Any allergies to any medicine
no,
or substance?
no,
Mm-hmm. Any surgeries on tummy or down below?
no,
Any family history of concern that you would like to share with me?
no, nothing.
Do you smoke, Mary? Mm-hmm. Mm-hmm. Do you
No,
smoke,
no,
Mary?
no, I'm
Any
not
alcohol?
smoking. No,
Mm-hmm. Any alcohol? Okay. Don't mind. Do you take any recreational drugs for fun?
no.
Any? How is the support otherwise?
I told you I live with my partner. I'm fine with him, but I'm scared from these to be a problem in my life. But he's fine.
Yeah. Yeah.
Mm.
Mm-hmm. What do you do for your living?
I'm a teacher.
Are you aware of your height weight ratio?
Yeah, it's 22.
Yeah. Yeah. Thank you, Mary, for sharing all this information with me. Anytime you are treated for any infections, like
No,
sexually transmitted infection, visiting gum clinic anytime?
no.
Thank you, Mary, for sharing all this information with me. Now I would like to examine you in the presence of chaperone with your consent. Is that okay? I'll be very gentle and you can stop me at any moment whenever you feel that you have pain. Is that okay with you?
Yeah, again, I will be examined again. It will be difficult to me.
Yeah, I can see that already. GP has examined you, and he couldn't insert the instrument, and I could see that. Is that okay? Can I try, or how do you what do you say? It
Yeah,
is with your
that's fine.
consent. Nothing is
Yeah,
against your.
that's okay. That's fine.
Yeah. Okay. If in case if there is any discharge down below, I'll be sending for a infection screen, and I'll be checking how the neck of the womb is, and if there is
Okay.
any painful areas on tummy or down below. Is that okay?
Okay.
Yeah. After examining you and spoken to you, I understand, Mary, that you have a condition called vaginismus. Do you have any idea about it? Anybody has
No.
discussed with you?
No.
Yeah, it's a condition wherein without your involvement, there will be sudden closing of the vagina. That we call it as involuntary action. Without your involvement, there will be a sudden closure. Even with any act, whether with touching, or it could be an instrument, introducing instrument, or a coital act, this can happen. That in medical terms, we call it as a vaginismus. Are you getting me, Mary?
Yeah. That's what's happened
Yeah.
always. Yes. Yeah.
Having this condition, you have few options. Shall I go ahead and describe?
Yeah.
Tell you about that? Yeah.
Yes.
You said that you already, yeah. You tried a few lubricants that are given by GP. Yeah, that is with which we also suggest you that you can try for another 3 months. And one more thing is we have a cognitive behavioral therapy where there is a relaxation exercises where you can try this. It is all supervised, and it will be trained by physiotherapist. So I'll put in touch with him. They will explain you this relaxation squeezing and relaxation exercises wherein you can relax, and you can try with this and for 3 months you can try with this, and even lubricants. And we have even dilators, the physiotherapist graded dilators. Slowly you can introduce these, and with the different sizes starting from the smaller size. With this we can try overall duration of 3 months. If it most of the women with this condition, with these lubricants, cognitive behavioral therapy, and graded dilators, they improve, and they'll have a they can have a consummation, that they can have a sexual life. I know you are going through a lot of turmoil, and you're worried about, and you're upset. So I'll put in touch with the counselor also there, so that they can speak to you and counsel you regarding this condition. And I'll document in your notes, and I'll write back to a GP. I'll give you this written information leaflets regarding this, so that you can go through again. Are you getting me, Mary?
Yeah.
Yeah, you can come back after 3 months. You can try these relaxation exercises, and you can come back. And meanwhile, I'll discuss with my consultant also. Anything
Thank
else you would
you.
like to discuss, Mary?
Thank you.
Yeah.
Thank you
Thank
for
you.
sharing,
Thank
Lee.
you.
Thank you.
Yeah.
Uh,
Yeah.
um, First of all, did you read the question well? Vishnu. Look, the question says
Yeah.
the patient shouting and refusing. Okay, so continue. What
Yeah.
is written? Yeah, you
Yeah.
examined her. You, the GP, can't examine her and send it to you.
Mm.
He said you examined her.
Okay.
So you examined her.
Yeah.
She's shouting.
Mm-hmm.
She crying
Mm-hmm.
because of the pain, and you give her a time. That's mean, and you return back to her to speak with her after this examination. So, look, the question last time in November came like this because there is online and there is no examination. Okay, so he said that in the exam, the question like that,
Mm-hmm.
similar to these, the patient has a problem in sexual act, and there is a pain during sexual act, and she want to become pregnant. She go to the doctor to see the doctor because she want to become pregnant. and at the same time she has a pain in the introducing. So the doctor did all the test and investigation she want, but because she has a period, okay, he can't examine her. Then he referred to you to examine, so you can examine her. So in the question said that you examine her, when you put the speculum, she shouted, she cried, and she went to the corner of the room. And now you must counsel this patient to know the cause behind these, and you manage this patient. So here the introduction is different because you already introduce yourself and because you already know her name and age, and you don't need to repeat it. So if you want to repeat the name and if you want to repeat the question again, you can say it like this: hello, from the beginning, how do you feel now? Are you better? Do you feel better? I'm sorry that this pain happened to you. I'm sorry. So apologize for what happened because it's happened after the examination. So you tell her, because I must, if you want to tell her what's your name and others, you can say that because I want to record these again. So please, I will repeat to you, your name is Mary Stephen, 28 years old, and I'm a doctor, blah, 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 who will do the consultation. Or you can start directly. I'm sorry for these. So are you relaxed now? So we can talk to each other. We can start. Can I take a history to know what happened or why happened these? And we can manage you later on. So the introduction here is different. In the exam, the last exam, I bring this case because of these. Here, the introduction is different. Otherwise, the management, you say it's brilliant, MDT, the physiotherapist, the psychosexual, all of them, you mention it. But here, the introduction is different. Do you understand me? So keep it in mind, because this the first time came in the exam like this, that you already examined this patient and you return back to her, so you don't need to do the introduction as before.
Understood.
Okay? Yeah. Okay.
So it is a follow-up visit. It is a follow-up visit.
Yeah, but you can you don't offer. That's why you must not offer her again examination. But you can tell her we can examine you in the under local anesthesia or under anesthesia to know more what is the real cause behind these. Is it vaginismus? Is it septum? There is something blockage. This is one. Okay, this is when you return back. So don't offer exam, because when you offer the exam, I told you, you will examine me again. So I want you to realize that you examine me, not the GP. Okay?
Yes.
Yeah.
Yes.
And
yes.
yes,
Yeah.
this is one point. We will come to the history. The history is okay, but forget some points which is important. Any vaginismus, any sexual intercourse dysfunction, you must clear the point that is there is any domestic violence. Maybe there is domestic violence. Maybe she's scared from it. Is it sexually abused when she was young? You must ask her like this. Some of these points you can ask her like this. I want to ask you some personal questions, because such of these pain can come by sexual abuse. Did anyone abuse you when you was a child or adult? She will let you know. Maybe the question, the hidden question, after she say yes, you will leave everything and you will go to the sexual assault and sexual abuse. And there is a question like that in the exam before. Okay, so you must clear the point of domestic violence in the question. It's important. She said that I'm scared that this will affect my relationship. So there is, you must also in the history ask her about the psychological and the mental health. You missed this point. It is very important in the history. Very, very important in the history. Maybe all the history is okay. Everything you said okay. If you miss these 2 points, you will lose the test.
Yes.
Because what is the causes of vaginismus, whether infection or fear or worried about the sex? Maybe her culture always scared her, from the sex. You must not do the sex. It is painful. It is so. When she's scared from it, she protects herself. They think like that before. So she grew up scaring from the sex. This is one. Scaring to become pregnant. there is sexually transmitted disease. You didn't clear point the sexually transmitted disease. You must ask her frankly, okay? Because she has only 12 months. This is one. All sexual abuse, all these points in the history must be cleared. Okay. Okay. Now regarding the examination, you say the examination, which is, well, I will examine you gently and others, but in the question last time she was examined by you, so don't repeat the examination, because she's still shocked and she's still scared, and you don't know it is psychological or physical until now. So you offer her in the question, in the exam, you can offer her to be examined under general anesthesia to know the real, is there is obstruction, or so it is it is obstruction and physical problem, or involuntary spasm to know it is vaginismus or not. Okay. Regarding the explanation of vaginismus, it is brilliant. Regarding the management, it is lubricant, as you say, physiotherapist, CPD, talking therapy, and asking her to, by the talking therapy, they will ask her to use her finger step by step, and the dilator, as you mentioned. Okay, and the psychosexual support also they need. Also, there is a botulinum toxin 8 also. They can inject it in the area to make the muscle spasm, and also it is type of a treatment. However, it can be repeated again and again. Otherwise, everything is okay. I don't have any other point other than the history, domestic violence and sexual abuse, and the examination. Don't repeat the examination, only this. Thank you.
Thank you so much. Thank you.
Thank you. What's your name?
Me, Vishnupriya.
What?
Vishnupriya.
Vishnu, okay. And there is Sunanda, sorry. Sunanda, is it here?
Dr. Samar, I can ask one question.
Okay, Dr. Tahsin. Yes.
If okay, if patient is not allowing us to examination, like GP has done that, but how before, without examining her, like how we can say that it is slowly, it's only basis she has vaginismus.
Look, if the patient refuses examination, your job is to make her accept this idea, because she will accept at the end, because you can't continue the management without to know the real cause. So if she refuses to be examined, give her a suggestion that she be examined under general anesthesia or local anesthesia, because she's scared from there. No one accepts to be examined and there is a severe pain like this. Okay, so you want to know it is involuntary spasm, or there is septum, or there is obstruction, or there is anything else. So she will not tell you no until the end of the case, because this is exam. This is not real. They want to know the management from you. If the patient insists, you must tell her no. I will give you another suggestion. She will accept this idea at the end. Okay.
Samar, excuse me, can I just say one thing?
Yes.
Dr. Samar, if we examine her under general anesthesia, then the diagnosis is based on the involuntary contraction of the vaginal muscles. So that is not going to happen under general anesthesia. So what is the general examination will only show us if there is any septum or anything. That's it. It's not going to confirm the diagnosis of vaginismus, is it?
Look, the question at the end, whatever you say, for if the face-to-face, and after if face-to-face, not online, if face-to-face, and you will give her local anesthesia or other, they will give you another paper. They will tell you this is the result. However, in the exam, they will give you a question, a paper or two paper, and at the end they told you we will find it is a vaginismus, for example, or the history, everything in front of you, leading you whether this is vaginismus or dyspareunia, according. Okay, so do you understand me? So there is no other cause. There is no question come for the septum. Okay, so but you must give the patient, the examiner, hint that you understand very well what is this question and why you go to the vaginismus, why you have this diagnosis. You know the case, but you give I must examine you in the general anesthesia to know more about and about. Okay, so if the result, you can say, for example, if the result comes that there is no any abnormality, that means you have vaginismus, and you start your management as this. Easy. Okay.
Okay, Dr.
Okay.
Samar.
Okay. So now we have Regina.
Yes, ma'am.
Can I do, Dr. Samar?
Who is it?
Ma'am,
Shagufta?
I'm present. Rajni.
Wait. Who is the second one?
Shagufta?
Rajni.
Now Regina, and I want to hear who said I want to do one.
Shagufta, Dr. Samar Shagufta.
And me also, Samar.
Yes.
Samar, me also. Musab.
Musab. Yes, Musab, yesterday I called you, but
Yeah,
yes.
yesterday
Okay.
I was
So now,
so busy.
okay, never mind. Regina, you will take one. Musab, the second one. Shagufta, I will give you tomorrow the first one. Okay?
Okay, thank you, Dr. Samar.
Okay.
Samar,
Regina.
Dr. Samar, tomorrow me also, another Rajni.
Okay, anyone to wait. I want because yes, I prefer a new one, but because some students who want to appear in today, they write it to me privately. So I say okay, but they are not here today. So please, okay. So I want to 3 for tomorrow. Now. Wait, Regina today, Aisha tomorrow, Mus'ab today. Wait,
I
so
also want
Aisha,
to do tomorrow,
wait,
Dr.
look,
Saima.
no, Saima, okay, so Shagufta, Aisha, and Saima tomorrow, okay?
Okay.
Dr. Samar,
Thank you, Dr. Samar.
we are,
One after one. Regina, I will start. Wait, start the
Dr.
2
Samar,
minutes.
there are two Rajni. I am different one.
Wait, please.
I am the one.
Who, Rajni?
Yes,
Who
ma'am.
was? Yeah,
Yes, ma'am, I'm there.
Rajni. Okay. So, yes. Yeah. Okay, start the 2 minutes.
Ma'am, can I start?
Waiting the 2 minutes. Adapt yourself. There is more half minutes after the 2 minutes in the online exam. So you have 2.5 minutes. Start.
I'm Dr. Rajni. I one of the doctors on duty today. Are you Mr. Brown?
Yeah.
So are you the husband of Mrs. Brown, Martin Brown?
Yeah. And I'm here because the hospital called me today to know what happened. What happened to my wife? I want to understand exactly the cause. Why you call me regarding her?
Um, yes, Mr. Brown. I can
You know,
totally.
I'm waiting here long time, just waiting to know what is the cause. There is no one tell me.
Mr. Brown, I'm really sorry and apologize you for the delay what has happened, and I can see that you are disappointed.
Yes.
But if you allow me, uh, I'm like if you allow me, can I ask you a few quick questions so that I know more about your wife's condition, and then I'll be able to explain her condition. Would that be okay for you, Mr. Brown?
Yes.
So, Mr. Brown, can you tell me what problems did she have, which made her underwent the procedure that uterine artery embolization?
1 week ago or 1 week or more, she was diagnosed as a fibroid, and she has a huge fibroid. So, and we want to have a baby. She don't have any baby, and we plan to have a baby, but they told it is difficult with this fibroid. So they suggest to us to do a uterine artery embolization, this procedure. And everything is okay until 2-3 days she starts to have fever, and she has tummy pain, and she complained that she's discomfort. And today morning her condition deteriorated, and we found that she must go to the emergency department. And after that, I don't know anything.
I am really sorry, Mr. Brown, that you had to go a tough time, and like your emotions are really understandable. If I was in your position, I would have felt the same. So, Mr. Brown, can you tell me that, like, what problems was she having, and since when were they having, which made her go for uh, this UAE?
I told you she has fibroid, and the doctor suggests that this procedure can reduce the size of fibroid, and she can become pregnant later on.
And were her periods regular?
Yes.
And like, what contraception was she using?
We don't use any contraception because she wants to become pregnant.
And is she updated with her cervical smear?
Yeah,
And
nothing worried about.
otherwise, is she medically fit and fine?
Yes.
And any other surgery she had in the past?
No.
And any family history of concern you would like me to mention?
No.
Um, so, is she taking any medication apart from the medication which were given to you after the procedure?
No.
Is she allergic to anything?
No.
Is everything happy at home, Mr. Brown?
Everything is okay.
Mr. Brown, like when Martin had come here, so she was having a fever, and like she was having a tummy ache, and so since this procedure was done few days ago, and her like pulse and BP were not in the best possible shape. So, in for the best interest of her, we had to take her for an emergency operation.
Okay.
And at the operation, the uh, the womb was there was so much of infection in the womb, and so in order to save the life of Martin, we had to remove her womb along with ovaries.
So That's mean you remove her womb.
Mr. Brown, I am really sorry to say this, but that was
But
done in
she
the
want to have a baby, because how can, what will happen next, and how can she become?
Yes, Mr. Brown, I can totally well relate to your emotions, and if I was in your position, I would have felt the same. So, Mr. Brown, but this, I would like to assure you that this was done in the best interest to save the life of your wife, and we will definitely do an incident reporting, and all the members who were involved in her care, an opinion would be taken from all of them, and as soon as the report is ready, we will definitely like to share it with you, and we'll be very honest with it. So, Mr. Brown, would it be okay to talk about further?
So, and how she's now? Did she know
Um,
about this?
so, Mr. Brown, she's in the ICU now, and we are running her on drips and taking the best possible care for her. And as soon as she'll be a little stable, I can make arrangements for you to meet her. Would that be okay, Mr. Brown, to tell you that how next can you be pregnant? Like, how can she be pregnant, and uh, you can have a child of your own? Would you like to hear that, Mr. Brown?
Is there any chance to have a baby?
So going further, Mr. Brown, since she does not have a womb, there is there is a possibility that possibility that if you want, you can adopt child, or you can even go for fostering. Am I clear so far?
Yeah,
Or
it's
the
a very
other
difficult
option is,
situation.
like, you can go for there is something known as surrogacy. Have you heard of this before?
No.
So in this uh, the eggs would be taken from the woman itself, and your sperm would be used, and the womb of the woman of whom we have taken the eggs would be used. So this is known as partial surrogacy in our terms. So in this way, you can have a child which is of your own biological component. Am I clear
أسماء,
so far?
please, anyone, دكتورة براء، دكتورة أسماء, switch off mic, switch off mics. دكتورة براء, switch off mics. Okay. Continue, doctor.
So I'm really sorry, Mr. Brown, that we had to take this difficult decision of removing her womb and ovaries. And as soon as she would get little stable, I would make arrangements so that you can see her.
Okay, but can you know why this happened?
So,
everything was fine.
Mr. Brown, I totally can well relate, and your emotions are totally understandable. So I can only tell that, like, infection happens in around 1 in 100 cases of people who go for this procedure, and we have to take a difficult decision of removing the womb, which happens in around 1 in 200 cases of women. So I'm really sorry that, like, the womb had got inflamed, and we had to take this decision just to save the life of your wife, Mr. Brown.
Okay, thank
I'm
you.
really sorry to be sharing this news to you.
Thank you. Thank you, doctor.
Is there any other concerns you would want me to address?
No, thank you. Thank you. No, thank you. You finished the 10 minutes. Okay. In general, it was okay. However, if we little bit change, you know, you find the husband is angry and the husband is waiting for a long time to know what happened to his wife. So you must start, or it's better to start like that. Hello, I'm doctor, blah, blah, blah. Or from the beginning, because this situation is a little bit difficult and there is, this way, it is not easy for anyone. So be formal. Mr. Brown, Mr. You know, Mr. So I think you said Mr. Brown, but okay. Doctor, your wife authorized me to talk to you about her condition. So he will accept, of course. So tell him directly, I want to reassure you that you're right now in the ICU in a stable condition. And if you want, I can arrange meeting with her directly. So you will count him or your wife in now in ICU, and she observed by a team of a specialist doctor, and she under monitoring there. And if you want, I can arrange a meeting to her. He will directly say yes, yes, because he is still angry. Tell me, okay, but before the meeting, shall I ask you a few questions regarding her to know more details about her and what happened? He will let you know that she did a uterine artery embolization. And so here you will start the history. The history. What is the history? You will ask. Did she? What happened after the operation? Is there is any complication when her complaint starts? The current complaint. When exactly the current complaint starts? Did she take her antibiotic? Is there is any fever? Is there is any vaginal discharge? Is there is any pain? What happened before she came to the emergency department? So he will answer you. In addition to other histories, such as the medical history, medication, allergy, all the other history, okay? So after that, you will let him know that, as you know, before you sign for the uterine artery embolization, the doctor tell you that there some complication could happen, whether at the meantime, at the time of the operation or after the operation, and you and your wife aware of these. So what happened to her because of this operation happened? So there is some infection, or there is some, or you can say when she came to the emergency department, she was in a critical condition, high fever and tachycardia, for example, or she was in a critical condition, and we when examine her, we reveal that there is infection inside the inside her tummy. So we decided to take her to the as emergency operation, and we will open her. We find that her womb is totally infected, and this is one cause or one complication of uterine artery embolization. You must mention this point clearly, that there is infection in the womb because it is a complication of uterine artery embolization. Okay, so we find that the only way to save her life is to remove the womb, and we preserve her ovaries. He said that to preserve the ovaries because he will ask you at the end, that she can, how can she become pregnant? So we can take the ova from her and surrogacy, as you mentioned. Okay, so otherwise everything is okay. So now after the operation, she will be observed by a team of a doctor, different specialty in the ICU. She will be monitored for blood pressure, pulse rate, respiratory rate, in addition to the blood, to the urine output. The patient is put in, there is a drains, there is the drain for her urine. She will put in an antibiotic and the blood thinning agent until she become fine, and we find that she don't need these monitoring. So she will return back to the ward, and after that she will be discharged when we feel that she's fine. He will let you know, we will ask you, and how can she become pregnant? So you told her, we remove the womb, but we preserved her ovaries. So we can collect later on the ovum by specialist technique. We can give you some written information according to these, and if you want, we can give you some appointment with a consultant in the fertility clinic. They can discuss with you all the possible way to become a biological dad, and she can become a biological mother. And then that's it. But try at the beginning how to count. This is the exam. You can't start. I don't prefer that you are starting like a history and other, because he's shocked. Okay, and he wants to know. I want to ask you. He wants some information about his wife. You can't. I reassure you that your wife now in a stable condition. She is monitoring in the ICU under observation of multiple doctors from different specialties. And if you want, I can arrange meeting to her. So directly he will see her, so he will be fine. But before the meeting, I want to ask you a few questions, and you can start your scenario and everything. Do you have any question for this case?
Ma'am, was it a pass station of borderline of fail?
This is the exam, yes.
No, ma'am. The station was like a pass, fail, or borderline.
On this question, what is the borderline?
No, ma'am. The performance.
Your performance. Look, sometimes you say everything in the exam, everything, but you didn't pass the test. You didn't pass this situation. I found that you say everything, but you didn't count the husband first. This is my point. You mentioned the uterine artery complication, you mentioned the surrogacy, you mentioned the how she became pregnant, but he is angry and he wants to know about his wife. So always when you find something like that, try to answer his question before. Okay, try to answer the questions before.
Okay, ma'am.
Yes, I found you are good, but this is the hint here. Start to calm him before to give him to take from him the history. Everything is okay. The third one is for Mus'ab. Mus'ab, are you here?
Yeah, I'm here.
Whose mic is open?
I'm here.
Okay, Mus'ab, start the 2 minutes. Start.
Catherine John.
This is structured discussion.
Okay. Okay. I'm Dr. Huida, and I'm ready for the discussion.
Hello, Doctor. Did you read the scenario?
Yeah.
Can you summarize to me?
She's 32 years old, female with amenorrhea for 18 months. She is nulliparous, not in a steady relationship, not using contraception. And now she had the symptom of low estrogen, like lack of sleep, loss of libido, mood swinging. So a symptom of ovarian insufficiency or premature ovarian insufficiency.
Okay. Would you be the most important diagnosis in her case? What do you think? What is possible diagnosis for her condition?
Possible diagnosis, premature ovarian failure or insufficiency. Amenorrhea for any other reason.
Like?
Ovarian cyst, ovarian cancer.
Okay.
If she has any hormone or herbal containing estrogen, is acylate or excessive exercise. If she had any tumor in head or nasopharyngeal space.
Okay. And now, what investigation would you do?
I will start with my first diagnosis is premature ovarian insufficiency. I will do for her FSH and LH.
Yes.
Estrogen level.
Okay.
And then if it is high, that is confirm the diagnosis. Okay. If it is normal, then I will think about central causes. So I need to rule out other causes like drugs and if she's taking any testosterone or an androgen or an estrogen, and might need to do imaging for the brain if there is any suggestion or any feature of cranial involvement.
Okay.
And also, I will try to rule out autoimmune disease if she is any thyroid dysfunction, any autoimmune thyroid disease, any other diabetes type 1, any other autoimmune disease. I find evidence of that. I need to do investigation to rule or confirm it.
Okay, so the FSH is 73, and what you can do next?
FSH 73, that means ovary is not producing any estrogen. So she is 32 years old. So I will explain to her that most probably there is a problem in the ovary producing hormone, and I need to retest it. I do it again after 4 to 6 weeks to confirm it.
After 4 to 6 weeks, it becomes 87.
So that is confirmed that this case of premature ovarian insufficiency.
Okay. And what is the effect of premature ovarian failure or premature ovarian insufficiency? So what's the effect on the body? What's its effect?
The effect on her general health, lack of estrogen will put her at risk of bad mood, sleep disturbance. It will put her cardiovascular risk. She will be prone for cardiovascular disease. For osteoporosis, her bone will be weak and fragile, so we have to take care of that. And also for reproductive, most probably she cannot have her own baby, but in 10%, sometimes sporadic ovulation can happen. But generally, it might be a problem to have her own baby. Also, with skin, estrogen had effect on skin and hair, so she have to ready for a lack of estrogen. And also, she will be more prone to be obese and overweight. And also, it will cause dry vagina, so she might develop dyspareunia.
Okay, and how to manage hair?
So I will explain to her that she need to take replacement, which is HRT, after ruling out any compelling indication of contraindication if she had venous thromboembolism, herself or in the family, if she is overweight, if she had any cancer, any risk or any history of cancer, breast or ovaries, or endometrium. So she had to take estrogen and progesterone combined because she has uterus, to protect the uterus. I will give her also option that estrogen can be in form of tablet or patches. Progesterone also, it can be in form of tablet or patches or myelin coil. So I will give her the option to see what more she prefer.
Okay, if the patient wants to become pregnant.
Okay, I will tell her the possibility that to have your own biological baby is very low, but we can use ovum donation if she agree for the idea, and using her partner sperm, and we can implant the baby in her uterus with hormonal support. This is one of the options.
Okay. Okay, so you prefer to give her some estrogen tablets, isn't it? So, in a type of hormonal replacement therapy.
Yeah.
Okay. So, what is the alternative for hormonal replacement therapy?
Hormonal replacement therapy, she can either tablet or patches or vaginal. Also, she can take tibolone, synthetic, and she can try herbal if she don't like. But for her, maybe the symptoms will be troublesome. She will need high dose. And herbs, I will inform her. She can take black
Okay, so I want to ask you a question. Now she take herbal
soybean. No guarantee.
Okay, she's now taking hormonal replacement therapy.
Other
yes. Okay. So what is the complication of hormonal replacement therapy?
Hormonal replacement therapy have general common complications like nausea, bloating, breast tenderness. It is common but not serious, but also it has serious complications like VTE, venous thromboembolism, breast cancer, and if estrogen alone, endometrium cancer. But for her age, because she's still at age below the menopause, usually risk factor HRT will not be harmful for her unless she had underlying predisposing or familiar risk.
Is there any contraindication for using hormonal replacement therapy?
Breast cancer patient and she had herself pulmonary embolism or deviant thrombosis.
Okay.
Maybe I cannot give oral, I can give patches if she has VTE. And
okay. Yes. Do you have anything you want to add?
Okay, it's very difficult diagnosis to give to the patient, so I need to give her appointment with counselor and give her patient information leaflet, and I tell her about all support ready for her, and give her a chance to come and meet my consultant for further discussion.
Okay, thank you. We finished the 10 minutes. Okay.
Thank you.
What I want to mention about the diagnosis, it's okay. It is whether premature ovarian failure or premature ovarian insufficiency. It could be PCO, it could be autoimmune disease, but always keep in your mind any amenorrhea happened at that age. Think about the pregnancy as well. So the pregnancy is one of the causes. You must start from minor to even it is 1 year without any period or something, she can become a pregnant any time, especially if she, for example, PCO. Okay.
Yeah.
The investigation you must do, the first thing you must do, a urinary pregnancy test. It's important. Otherwise, you mention everything, the FSH and LH, and according to the results of FSH, LH, if they are high, that means this is repeated after 6 weeks or 4 to 6 weeks, as you mentioned, yes. It is definitely the diagnosis of premature ovarian failure or insufficiency. Autoimmune screen, you mentioned these. Brilliant. This is the important imaging of the brain, because if there is a prolactinoma or there is any brain tumor can lead to these amenorrhea. This is also right. Okay, what is the effect or premature ovarian failure? It is look like a menopausal symptoms, sleep, lack of sleep, or loss of libido, mood swinging, osteoporosis, cardiovascular disease, fertility, psychological upset, all this can lead by the similar to amenorrhea because of lack of estrogen. Okay, how to manage this patient? As you mentioned, first of all, I let her, if she need any psychological support, I will offer her hormonal replacement therapy or any herbal other than the hormonal replacement therapy according to her symptoms. According to her symptoms, for example, loss of libido, I can give her some testosterone. The mood swinging, I can send her to psychological counselor. Also, in a hormonal replacement therapy, it's important to protect her bone and her cardiovascular system as well. If she wants to become a pregnant, so I will give her the egg donation. The important point in this case, because she's still young, you must let her know that this hormonal therapy, it is not a contraception. So if she don't want a baby, she must use contraception in addition to the hormonal replacement therapy. Okay. What is the alternative? You say that herbal calcium replacement, tuberone, as you mentioned. Okay, what is the side effect of the hormonal replacement therapy? You can say that it is irregular vaginal bleeding, weight gain, breast tenderness, nausea and vomiting, headache, thromboembolism. It is one of the side effects of it. Breast cancer is a risk factor for these, and it can be increase the risk of the breast cancer. What's the contraindication? As you mentioned, first thing, it is breast cancer. Undiagnosed vaginal bleeding, endometrial cancer, any type of cancer with estrogen, especially receptor positive. Pregnancy, breastfeeding, thromboembolism, any renal or liver disease, all these consider as a contraindication for this condition. I think we finished everything. Now, is there any question? Good.
Ma'am, I
Yes.
have a question. So she is looking to have babies. So then, like immediately we'll refer her to fertility center, or we'll put her on some medications. Then when she's stabilized, then we would refer her to a fertility center.
If she wants a baby.
Yes.
if she wants a baby, as she asked, because she did two tests. The first one is 73 and the second one is 84, 87 or something. So she repeated the FSH. She's premature ovarian insufficiency. It is unlikely to have any ova. So the only way is donation if she wants to become pregnant, okay, or adoption. But from her eggs, it is difficult unless it can be happen by chance. But you must let her, if she don't want a baby, she must use a contraception because the hormonal replacement therapy is not contraception. Okay. So any questions?
I forget the pregnancy and the contraception.
The pregnancy and contraception, yes. Any amenorrhea, look, two things. Any amenorrhea, you must do pregnancy test and exclude the pregnancy. Any vaginal bleeding abnormal, you must exclude the pregnancy also. Okay, in the question, any question come like these or like these, you must exclude pregnancy. Anything? Any question? Thank you. Thank you all.
Any role of karyotyping here?
Karyotyping for
Turners, like
to
it's
know the cause. To know the cause, you can, because it could be Turner syndrome as well, mosaic or others. But at the end, you can mention it. You can mention it, but it will not help a lot.
Okay, thank
you. To reach the diagnosis, it not help a lot. Okay, thank you.